Welcome to the 2027 AHIP Final Exam Prep Training. I am glad you are here because this year there are some meaningful changes to what CMS is requiring agents to know before they can sell Medicare Advantage and Part D plans. This briefing is designed to walk you through the most important updates, the rules that changed, the concepts getting more exam weight, and the common mistakes that cost agents certification points every single year. We are going to move through 14 topics together. Some of these will be familiar ground with a new twist, and others represent genuinely new territory for 2027. By the end of this session, you will have a clear picture of what the exam is testing and where to focus your final review. Grab a notepad, take notes where something catches your attention, and let us get started. The goal today is simple: get you certified, keep you compliant, and make sure your clients are protected. Let us start with the big picture. 2027 is being called a deregulation year for Medicare marketing, and that label matters. Over the past several years, CMS put in place a series of extra safeguards around how agents could market and sell Medicare plans. Some of those were responses to complaints about aggressive or misleading sales tactics. But for 2027, CMS has pulled back several of those rules. This does not mean compliance goes away. It means the specific restrictions that were layered on top of the baseline rules are being lifted. The key event to know is that CMS issued its final rule for 2027 and 2026, and that is when the deregulation became official. Your exam will test whether you understand what changed and why. When you see a question asking about marketing regulations or agent conduct, remember the theme. 2027 represents a deliberate step back from the extra guardrails, returning closer to the pre-pandemic baseline while still requiring agents to act in the beneficiary's best interest. Now let us talk about Rule 1, and this is a big one. For the past couple of years, agents were required to wait 48 hours after collecting a scope of appointment before they could hold a plan-specific sales appointment. The idea was to give beneficiaries time to think before being presented with plan details. For 2027, that 48-hour wait is eliminated. You can now collect the SOA and hold the appointment the same day. This is a significant change in how you can structure your sales process. However, do not misread this. The SOA itself is still required. You must still collect the scope of appointment before you discuss any plan-specific information. What changed is only the waiting period between getting that signature and having the conversation. If you see an exam question about whether SOA is still required, the answer is yes. If you see a question about whether there is still a 48-hour wait, the answer is no. Same-day appointments are now fully permissible as long as the SOA is obtained first. Rule 2 addresses educational events and sales conversations. Previously, there was a required 12-hour gap between hosting or attending an educational event and then conducting a sales conversation with the same person. This rule was put in place to prevent agents from using educational events as a funnel directly into same-day sales pitches. For 2027, that 12-hour gap has been eliminated. You can now transition from an educational event to a sales conversation without waiting. This creates new flexibility in how you structure seminars, community events, and informational meetings. But here's the trade-off your exam may ask about. Just because the gap is gone does not mean anything goes. The distinction between educational and marketing events still matters, and we will cover that in detail shortly. The exam wants to know that you understand both the old rule and the new one, and that you can apply the current standard correctly. When you see a question referencing the 12-hour gap, the correct 2027 answer is that it no longer applies. Rule 3 is about language, specifically superlative language in marketing materials. For a period, CMS restricted agents and plan sponsors from using terms like best, most, highest rated, or number one in marketing because those claims can be misleading when not properly substantiated. For 2027, the use of superlative language has been restored, meaning it is once again allowed. But the slide says to use it with caution, and that guidance is important. Just because superlatives are permitted does not mean they are unregulated. Any superlative claim still needs to be accurate, verifiable, and not misleading to beneficiaries. If you claim a plan has the best benefits, you need to be able to back that up. The exam will likely test your understanding that the restriction has been lifted, not that superlatives are now a free-for-all. The key takeaway is allowed with care. You can use these terms again, but compliance still requires accuracy and substantiation behind every claim you make in a marketing or sales context. This slide is one agents consistently get wrong on the exam, so pay close attention. There's a critical difference between a marketing event and an educational event, and confusing the two is a compliance problem. An educational event is designed to inform. It covers general Medicare information, how the program works, what beneficiaries need to know. At an educational event, you cannot distribute plan-specific marketing materials, and you cannot accept enrollment applications. A marketing event, on the other hand, is explicitly designed to generate sales. At a marketing event, you can discuss plan-specific benefits, distribute materials, and accept enrollments. The disclosure requirements differ between these two types of events as well. At a marketing event, you must make specific required disclosures about your role as an agent and what plans you represent. The exam will present scenarios and ask you to classify the event type and identify what is and is not permitted. Study the distinctions carefully. Knowing the line between education and marketing is among the most tested compliance concepts on the AHIP exam. Let's shift to Part D, the prescription drug benefit. This slide tracks the journey of the Part D redesign from guidance to regulation. Here is the timeline you need to know. The Inflation Reduction Act was enacted in 2022, and it included major changes to how the Part D benefit is structured. For the years following, CMS implemented those changes through guidance, meaning sub-regulatory direction rather than formal rulemaking. That meant the changes were real and in effect, but they existed in a kind of temporary regulatory space. For 2027, those changes have been formally codified as permanent CMS regulation. This is significant because it means the rules are now locked in through the full regulatory process, not just administrative guidance. Your exam will test your understanding of this distinction. If a question asks whether the Part D redesign changes are now permanent regulation, the answer is yes as of 2027. Understanding where a rule comes from, whether it is statute, regulation, or guidance, is an important concept throughout Medicare compliance. Now let's walk through the three phases of the Part D benefit because the structure has changed significantly and the exam will test this in detail. The traditional Part D structure had four phases: the deductible, the initial coverage period, the coverage gap, sometimes called the donut hole, and catastrophic coverage. For 2027, the coverage gap has been eliminated. The benefit now has three phases. Phase 1 is the deductible phase, where the beneficiary pays out of pocket up to the plan's deductible. Phase 2 is the initial coverage phase, where cost sharing kicks in. Phase 3 begins once the beneficiary reaches the annual out-of-pocket cap, which is a hard cap established by the Inflation Reduction Act. Once that cap is reached, the beneficiary pays zero for covered Part D drugs for the rest of the year. This is a transformational change for people with high drug cost. Make sure you understand both the old four-phase structure and the new three-phase structure because the exam may reference either and ask you to identify what is current. Related to this Part D redesign is a change to how drug manufacturer discounts work. The program is now called the Manufacturer Discount Program, or MDP. Under the old structure, manufacturer discounts help beneficiaries in the coverage gap, but those discounts did not count toward the beneficiary's out-of-pocket costs. That created a situation where beneficiaries were receiving help but not getting credit for it in terms of reaching catastrophic coverage. Under the Manufacturer Discount Program for 2027, the structure is different. Manufacturer contributions in the catastrophic phase now count toward the beneficiary's out-of-pocket spending. This means beneficiaries can reach the out-of-pocket cap faster when manufacturer discounts are applied. From an exam perspective, you want to know the acronym MDP, what it replaced, and the key functional difference. Manufacturer discounts now count toward the out-of-pocket cap in a way they previously did not. This is a detail that can appear in scenario-based questions about how much a beneficiary owes throughout the year. Star ratings reflect a critical part of the Medicare Advantage and Part D landscape, and CMS makes changes to the rating methodology every year. For 2027, one proposal that did not move forward is important to know. CMS had proposed a Health Equity Index reward, sometimes abbreviated as HEI, that would have provided a bonus to plans that performed well on measures related to serving low-income and underserved populations. That reward system was proposed, but it is not being implemented for 2027. Instead, CMS finalized a different approach. The exam will likely test whether you know the status of the HEI reward. The answer is clear. It was proposed, it was not implemented. Do not confuse this with health equity as a concept, which remains a priority for CMS. The specific reward mechanism described in the proposed rule did not make it into the final rule. When you see exam questions about the Health Equity Index reward, remember, not moving forward for 2027. That distinction between what was proposed and what was finalized is a classic exam trap. As for star ratings in 2027, CMS made significant changes to the actual measures used to calculate plan scores. For 2027, 11 measures have been removed from the star rating methodology. These were primarily administrative measures or measures with very low variation across plans, meaning they were not providing meaningful differentiation in quality. At the same time, one new measure has been added, Part C Depression Screening and Follow-up. This measure evaluates whether Medicare Advantage plans are ensuring that beneficiaries are being screened for depression and receiving appropriate follow-up care when screening results are positive. It is worth noting that this new measure has a delayed implementation timeline for full impact, so you may see questions about when it fully counts in ratings calculations. From an exam standpoint, know the numbers. 11 removed, 1 added. Know the name of the new measure. And understand that the overall direction of the star rating changes is toward fewer but more meaningful quality measures that better capture real differences in plan performance. This exam year gives more weight to questions about specific plan types, and this slide highlights 4 that you need to know cold. First is the Private Fee-for-Service Plan, or PFFS. This is a Medicare Advantage plan where the plan determines payment rates rather than using a provider network in the traditional sense. Providers must accept the plan's terms to be paid, and beneficiaries have flexibility in choosing providers who accept those terms. Second is the Medical Savings Account Plan, or MSA. This combines a high-deductible Medicare Advantage plan with a savings account funded by Medicare that beneficiaries can use for healthcare costs. Third is Special Needs Plans, or SNPs, which are Medicare Advantage plans designed for specific populations. People with certain chronic conditions, those who are dual eligible for Medicare and Medicaid, or institutionalized individuals. Fourth is PACE, the Program of All-Inclusive Care for the Elderly, which provides comprehensive care for frail elderly individuals who meet nursing home level of care but live in the community. Know the eligibility rules, network structures, and key features for each of these. Before finishing up this content, let us talk about the exam itself so you know exactly what to expect when you sit down to take it. The AHIP certification exam requires a passing score of 90% or higher. That is not a typo, 90%. This is a high bar, and it means you cannot afford to miss many questions. The exam is open book in the sense that you can reference your study materials during the test, but do not let that give you a false sense of security. The questions are written to test understanding and application, not just whether you can look something up. Read every question carefully. The exam frequently includes answer choices that are partially correct or that describe rules that were true in a prior year but not in 2027. Read all the answer options before selecting. Pay attention to words like always, never, must, and may, because those absolute terms often signal a correct or incorrect answer. Time management matters too. Do not rush, but do not spend too long on any single question. If you are unsure, make your best selection and move on. You can review flagged questions at the end. We've covered so much ground here today, so let us bring it home with your 4 key takeaways. Number 1, 2027 is a deregulation year. The 48-hour SOA wait is gone, the 12-hour educational to sales gap is gone, and superlative language is restored. Know what changed and why. Number 2, Part D has been redesigned. 3 phases, no coverage gap, a hard out-of-pocket cap, and the manufacturer discount program now counting toward that cap. Understand the structure inside and out. Number 3, star ratings changed. 11 measures removed, 1 added. The HEI reward was not implemented. Know the final rule, not the proposed rule. Number 4, plan types are getting heavier exam weight. Review PFFS, MSA, SNPs, and PACE until you can describe each one clearly. Now a word on certification. Do not wait until the last minute. Early certification protects you, your agency, and your clients. Agents who fail to certify on time lose the ability to sell, and that affects your book of business. Get it done early, get it done right, and go into open enrollment confident and compliant. Good luck, and thank you for your time today.